Hi everyone. Today I'm going to be discussing the diagnostic process for NAFLD/MASLD. NAFLD is the most common chronic liver condition in the Western world. We'll talk through the approach clinicians take from suspicion to confirmation. Step one when you enter the doctor's office is going to be a clinical assessment. We're going to ask about body weight, diabetes, cholesterol, alcohol intake. The physical exam might be completely normal unless the liver is already enlarged or damaged. Number two, we're going to get some blood tests done. Blood tests help to identify liver inflammation and rule out other causes like hepatitis or autoimmune diseases. Even if liver enzymes are normal, NAFLD/MASLD can still be present. That's why we will use a multiple test together to make sure we're getting the right diagnosis for you. Thirdly, to confirm our diagnosis, we will likely do some level of imaging study. An ultrasound is usually our first tool to confirm if there's liver fat. For fibrosis, if there's a lot of fat buildup, we'll use a FibroScan, which allows us to measure liver stiffness and identify those with advanced liver disease non-invasively. It's unlikely you'll get sent for a CT or MRI, as these tests can be quite expensive, but you'll definitely have an ultrasound. And then if your center has one, you'll get a FibroScan as well. Number four, this is the gold standard. This is a liver biopsy. So the liver biopsy confirms the diagnosis and shows inflammation and scarring under the microscope. It's used when we need clarity to make key treatment decisions, especially in complex or high-risk cases. So this is if we're not sure of what the key condition might be, or if you're going for something like a major surgery, like a resection or a transplant, it's likely that you'll have a liver biopsy. It'll also be used when we're not sure what the condition is. For instance, if you've got cryptogenic disease. These are the four stages of testing. You may have all of them, you may have just 1 to 3 of those. And to summarize today's session, once you've got clinical suspicion based on your risk or incidental findings, we're likely to take a history, examine bloods, and rule out any other causes. Some level of imaging, ultrasound, and maybe a FibroScan. And then, if needed for advanced assessment, likely to have a liver biopsy done. Thanks for watching, guys. If you have any questions, drop me a message. Peace.